talking about something the NCLEX loves to test on, and that's infection. I'm Dr. Emily, and this is HIV and AIDS. So, HIV, or human immunodeficiency virus, is a retrovirus that attacks your CD4 T cells, which are important cells in your immunity. So, over time, this weakens the immune system and can ultimately progress to autoimmune deficiency syndrome, or AIDS. And HIV is considered a retrovirus because instead of a typical virus, which copies DNA to RNA to proteins, HIV uses reverse transcriptase to transcribe RNA to DNA, and then it inserts that DNA into the CD4 T cells, where it hijacks the cell machinery to use it to replicate itself. So this DNA literally becomes a part of your cell's genetic material and is why HIV has no cure. So because it has no cure, our number one priority then focuses on preventing transmission. And transmission occurs when infectious body fluids like blood, semen, vaginal secretions, or breast milk come into contact with non-intact skin or mucous membranes of a non-infected individual. And although there is a stigma, it's important to remember that HIV is not spread by casual contact like hugging, so don't fall for that option on the NCLEX. So we should be teaching prevention measures to all patients, especially those engaging in high-risk behaviors for HIV transmission, with the highest risk behavior being needle sharing during IV drug use. So teach clients who are IV drug users never to share needles, because if you do so, you're literally injecting someone else's blood into your bloodstream. So you can even connect them with a syringe exchange program where they can bring used needles and exchange them for clean needles. All patients should practice safe sex by always using condoms, and we should also perform routine HIV testing during prenatal care to prevent mother-to-baby spread. And for patients who have an ongoing risk of exposure, like someone who has an HIV-positive partner, they can take pre-exposure prophylaxis or PrEP before that exposure. And if there's an accidental exposure, like if a condom breaks, we can offer post-exposure prophylaxis or PEP, which should be started within 72 hours of the exposure. And of course, even if we don't know their HIV status, we should follow standard precautions for all clients, which includes wearing gloves when handling blood and body fluids, and using safety needles and puncture-proof containers to prevent needle stick injuries. So in the initial diagnosis, it's important not to forget that there is a 3-week window period after infection where the virus is still undetectable. So if a patient is requesting an HIV test during that time, we can offer it, but it's important to teach them that we will need to retest after this period to make sure it wasn't just too soon. And HIV infection is confirmed with HIV antibody and antigen testing of blood or saliva. And this is a reportable illness, so we need to report all new diagnoses to the local public health authorities for contact tracing purposes. Then, once that diagnosis is established, these patients will require lifelong monitoring. So we're going to perform frequent monitoring of their CD4 counts and their viral load. So their CD4 counts we're going to see decrease as HIV progresses, but this can be slowed using antiretroviral therapy. And we'd also want to see their viral load decrease, because decreasing levels means a less active disease. And our goal of treatment is to go all the way to 0, because an undetectable viral load means untransmittable. They're still infected, but they can't transmit the disease to others. And as we're watching their CD4 counts and viral loads, we're specifically watching their progression through the stages of HIV infection. So initially, during the acute stage 1, their viral load is very high. So they're going to feel sick with flu-like symptoms, weight loss, and swollen lymph nodes. Then, during stage 2, or the chronic stage, they may be asymptomatic for months to years, or even their whole life if they can stay adherent with their ART therapy. But we can't prevent that progression in everyone. So it may progress to stage 3, which is AIDS. This is the end stage of the disease and causes significant immunocompromise. These patients will have fever, night sweats, chronic diarrhea, and recurrent infections. And AIDS is diagnosed when either the CD4 count goes below 200 or when an opportunistic infection occurs, like candidiasis, Kaposi sarcoma, PCP pneumonia, TB, or toxoplasmosis. All right, time for your first NCLEX quick check. Pause and take a moment to answer. All right, first, what practice has the highest risk for transmitting HIV? And remember, IV drug needle sharing injects someone else's blood into your bloodstream, so don't do it. Don't share needles. Next, what recommendation should the nurse make to prevent the spread of HIV by sexual transmission? So for this, patients should use barrier methods like condoms and can take PrEP before exposure and PEP within 72 hours after exposure. Which two laboratory tests are monitored to assess HIV progression and treatment? And that is going to be your CD4 count, which we want to see stay high, and your viral load, which we want to see go low. When is AIDS diagnosed? So AIDS is diagnosed when either the CD4 count is under 200 or the patient develops an opportunistic infection. Great job. So to intervene for HIV, we're going to administer antiretroviral therapy, or ART, prevent HIV transmission, prevent and monitor for opportunistic infections, and provide psychosocial support. To prevent transmission of HIV from our patient to others, the number one priority is adherence to antiretroviral therapy, because ART prevents transmission and delays progression of the disease to AIDS. And the goal, remember, is that we would decrease the viral load all the way to undetectable and increase the CD4 count. And there's a big public health campaign called U=U, where undetectable means untransmittable. So make sure your patient knows this is the goal. And to reach that goal, we should teach them to never skip doses, because even one missed dose can cause the virus to develop drug resistance. So to prevent missed doses, they can use reminders like an alarm on their phone or pill organizers. And instead of stopping the drug if they don't like the side effects, we should teach them to report any unmanageable side effects to their provider so they can troubleshoot it or start a different drug. They should also ask their healthcare provider about all medications and supplements, even over-the-counter ones, because they may interfere with their ART effectiveness. ART is also administered during pregnancy, breastfeeding, and to newborns of HIV-positive mothers to prevent mother-to-baby spread. So to prevent transmission to others, HIV-positive patients should practice safe sex, including use of barrier methods, and they can follow some infection control measures to prevent spread within their household, including, of course, frequent hand hygiene, never sharing personal items like toothbrushes, washing dishes and utensils in hot soapy water to kill bacteria, and using PPE like gloves when handling body fluids or contaminated items. So this prevents transmission of HIV from our patient to others. We also want to prevent infection of our patient by opportunistic organisms, because opportunistic infections are the leading cause of death in HIV-positive patients. So to prevent infection, number one is we want to promote adherence to their antiretroviral therapy, because that's going to keep their immunity strong. And of course, they should also practice hand hygiene and frequent skin and oral care to prevent candidiasis. And they should receive vaccines and avoid crowds. And they should not consume any raw or undercooked foods. So this is to prevent infection. They should also monitor for infection and report any signs of opportunistic infection to their provider. So to do this, they should monitor their temperature daily, and they should report any cough or skin changes, including the reddish-brown skin lesions characteristic of Kaposi sarcoma, which is a classic opportunistic infection that develops in HIV-positive individuals. And so is tuberculosis, so these patients should undergo routine TB testing as well. And of course, we want to provide psychosocial support to manage the depression, anxiety, and social isolation that comes along with the terminal nature and social stigma of the disease. So to do this, we're going to consult mental health services, refer them to HIV support groups, and ensure that clients have advanced directives in place. And by now you realize that antiretroviral therapy is the most important part of HIV care. So let's take a closer look at the specific drugs. So remember, antiretroviral therapy does not cure the disease, but it does delay progression and prevent transmission if U=U. And typically these patients are on more than one drug, because these drugs work on different steps to prevent replication and keep the disease under control. But taking multiple ART drugs for life is very hard on your liver. So we want to warn them about the risk of hepatotoxicity. And in addition to monitoring their CD4 count and viral load, they should also undergo monitoring of their liver enzymes. And just be sure you can recognize some of these drug names. So entry inhibitors block HIV from entering the CD4 cells, and NRTIs and NNRTIs inhibit reverse transcriptase, which prevents replication. But these can cause renal toxicity or lactic acidosis, so monitor the BUN, creatinine, and serum lactate. And integrase and protease inhibitors block integrase or protease to prevent insertion and replication. But either of these can cause hyperglycemia, so be sure your patient monitors their glucose levels. All right, so for your last NCLEX quick check, pause and take a moment to answer. All right, what is the best way to prevent HIV progression and transmission? And I hope you know it by now. It's antiretroviral therapy adherence. List 3 ways the client should monitor for infection. So these clients should monitor for fever, cough, and skin changes. They should get routine TB testing and should monitor for the reddish-brown skin lesions of Kaposi sarcoma. And finally, which lab value is important to monitor in clients taking ART? So in addition to their CD4 and viral load, we want to follow their liver enzymes to make sure they're not developing hepatotoxicity. And now you're ready for HIV and AIDS on the NCLEX. Thanks for joining me.